السلام عليكم، بسم الله الرحمن الرحيم. معكم زياد. اليوم إن شاء الله رح نرجع نكمل شرح مادة الهيلث ساينس. وصلنا عند الدرس الرابع في Chapter 2. الدرس الرابع Chapter 2 Diseases and Disorders of the Respiratory System. So we learn the parts of the respiratory system, the functions of the respiratory system, and the diseases and disorders that affect the respiratory system. Okay, so first thing first, we will start with the parts of the respiratory system. We have 5 main parts: nose, الأنف, trachea, القصبة الهوائية, bronchus اللي هي الشعبتين الهوائيتين, وbronchioles اللي هي الشعب الهوائية, and last thing which is lungs اللي هي الرئتين. And we have alveoles, which are small cell bags in the lungs where gas exchange happens. Alright. So those are the main parts of the respiratory system. Now we will know what are the conditions that affect the respiratory system. We have 4 main conditions. First thing, which is asthma, chronic obstructive pulmonary disease, COPD, pneumonia, and we have virus infections such as COVID-19. Let's start with asthma. So asthma is a long-term disease that causes inflammation in the airways. When there's an inflammation in the airways become swollen, so they become tighter, and they become also less. There will be less area for breathing and for air to pass, so this will make breathing harder. الأزمة بالعربي اللي هي الربو. الربو ينشأ عن التهاب الشعب الهوائية والممرات الهوائية. لما تلتهب الممرات الهوائية يصبح التنفس أصعب، لأن الممرات الهوائية تتورم وتصبح ضيقة، فالهواء يصعب مروره إلى الداخل أو خروجه من الرئتين. طبعا it can begin in childhood and lasts into adulthood. It is more common if there's family members that have it or the person is exposed to smoking. تبدأ من الصغر وتدوم حتى تدوم مع الشخص طول العمر. تعد chronic disease، مرض مزمن، ودائما إذا كان في أشخاص بالعائلة عندهم أزمة، فاحتمالية إنه شخص يصاب بالربو تكون عالية. So it's also there's genetic factors، عوامل جينية. أيضا التدخين والحساسيات الأخرى لها دور في الإصابة بالأزمة بالربو. إذن signs and symptoms of asthma. We have 4 main signs. There's a lot of other signs, but those are the 4 common signs: coughing, shortness of breath, the person feels that it's hard to breathe, tightness in the chest, and wheezing or whistling when breathing. So there's a sound when the person tries to breathe. 4 أعراض رئيسية اللي هي الكافينج، السعال، و shortness of breath، ضيق في التنفس وضيق في الصدر، وأيضا إصدار صوت أثناء التنفس نفس الصفير. We have now treatment of asthma. Asthma cannot be treated. There's no cure for asthma, but it can be the signs can be treated using some medications, and there's a very effective way to treat them. So we have long-term medications that should be taken daily to control asthma and its signs. We have medications that can be used during an asthma attack, so the person doesn't take any medication unless they have an attack, like the inhalers. And we have lifestyle changes such as stopping smoking if the person is a smoker, or having a healthy diet, changing the diet of the patient. Also, physical exercise help the person that has an asthma. بالعربي long term medications اللي هي الأدوية على مدى طويل، الشخص يأخذ الدواء يوميا للتقليل من أعراض الربو، أو أدوية تأخذ فقط في حالة أزمة الربو، نفس الانهيلر اللي هو الدواء اللي يستنشق ويفتح الشعب الهوائية. ولايف ستايل تشينجز نفس تغيير النظام الصحي للشخص، إيقاف التدخين، تمارين رياضية إلى آخره. So now we are done with asthma. We will study COPD, which is COPD is a respiratory illness that causes breathlessness and difficulty in breathing. It gets worse over time. So COPD بالعربي اللي هو عبارة عن مرض تنفسي قد يسبب انعدام التنفس أو صعوبة كبيرة في التنفس. Also, forms of COPD include bronchitis and emphysema. COPD is a serious illness and it can cause complications. It can cause death also. It begins around the age of 30 or 40. Both men and women have risk to have it, and people who smoke have a greater risk of developing COPD. People also who have asthma are exposed to air pollution. They are more likely to develop COPD. Signs and symptoms of chronic obstructive pulmonary disease: shortness of breath, ضيق في التنفس; wheezing, so a sound when breathing, صوت أثناء التنفس يعني; chest tightness, ضيق في الصدر; chronic cough. So they are kind of similar to the signs and symptoms of asthma. Also, we have treatment now of chronic obstructive pulmonary disease. Not smoking, so stopping smoking if the person is a smoker. Medications to relax the airways and make it easier to breathe for the patient, and steroid medications that reduce the inflammation in the airways. So it's also an inflammation of the airways that can be treated using steroids or medications to relax the muscles of the airways, or stopping the smoking if the person is a smoker. Last thing is pneumonia. Pneumonia is an acute infection. Either it is bacterial or viral. It can be caused by bacteria or viruses, and it is usually communicable disease. It causes cough, it causes fever, and it makes it heavy to breathe, makes it harder to breathe. Anyone can develop pneumonia, including children and adults. Usually children under the age of 2 and adults over the age of 65. They are the most people at risk of developing pneumonia. A person with other serious disease like a heart disease or COPD or asthma, they are more likely to get pneumonia because already their respiratory system is weak. Signs and symptoms of pneumonia: chest pain, confusion, cough, shortness of breath, fever, sweating and chills. Fever, sweating and chills, shortness of breath, so it's hard to breathe, chest pain while breathing, cough and confusion. Treatment of pneumonia, usually if it's a mild infection, that can happen like all year long to anybody, so we usually just take antibiotics at home and pain medications to manage the fever and relieve the pain. If it is a serious case, like the patient can't breathe at all, or he's unconscious, then the patient need to be taken to a hospital. He need to be hospitalized. Treatment includes medication, and we use a machine that's called a ventilator to help the patient breathe. So that's it for the diseases and disorders of the respiratory system. We learned the parts of the respiratory system. We learned the diseases that can affect the respiratory system: asthma, pneumonia, and COPD, chronic obstructive pulmonary disease. That's it. Thank you for listening, and see you in the next video about lesson 5 in chapter 2. Thank you.